Great. Good evening. My name is Fraser Goodwin, and I'll be moderating this session. And my laptop just decided to switch off. How very convenient. Right. Now that technical glitch, there's always a technical glitch, is over. Just explain that I'm the policy coordinator with EFA, that's the European Federation for Allergies and Airway Disease Patients Associations in Europe. And this session is brought to you by a project, Keep Breathing, which is also part of the European Lung Health Group's activities. And that's a collection that brings together patient groups, professional societies, researchers to advance the needs of all those with lung health issues. And we should begin by thanking the European Health Forum Gastein for including the topic of lung health in this year's programme. But it is actually a crucial topic to discuss if we're going to really rethink solidarity in health and actually heal Europe's fractured social contract. We had a very good session earlier on in the Cursal on that very topic. And if we are to do that, then we really need to align our priorities on European health with the biggest health burdens and biggest health problems. And that includes, of course, lung health. So I wanted to begin with a short description of why respiratory health needs to be front and centre of health policy across Europe. Now, in many respects, I imagine everybody in this room and most of the people online are already rather convinced of the need to have lung health as a priority. But nevertheless, it's really useful to remind ourselves of the figures, some of the facts and figures. There are more than 80 million people who live with chronic respiratory disorders in the European region, or about the same number as the total population of Germany. So it's a huge number. And nearly 6.8 million people yearly are newly diagnosed with chronic respiratory disorders. And 400,000 deaths are attributed to that, with COPD accounting for 80% of those deaths. But it's also important to reflect what those extremely large numbers mean to the people behind those numbers. It means lives blighted by conditions that are treatable. It means struggles for diagnosis and treatment. It means not just lost productivity, but frustration and pain and extreme discomfort and mental anguish for all those people. And addressing such a large-scale burden is essential if we are to rethink health solidarity and repair our fractured social contract. So this first session will firstly review the scale of the problem, present and then review what we're now undertaking collectively to address this burden. And between those two sessions, we'll have a short Slido and audience participation. And at the end, we'll also try and engage you in the audience, both here in Gastein, but also those of you watching online. So given the scale of the respiratory health, of course, reminded by the pandemic, which we all lived through so recently, a one-in-a-century event, we have to reflect on why it's taken so long for things to change. Why has it taken so long for respiratory health to get the policy attention that it deserves? And that reflection brings us nicely to our first speaker, Jose Luis Castro. We're honoured, really, to have you with us today, the WHO envoy for chronic respiratory diseases at the global level. And so my question to you to open the discussions are, what are the key issues that keep you busy in your role? And what are you asking policymakers from them today?
Thank you very much. That's a very pertinent question. As you clearly described, the burden of chronic respiratory diseases is enormous, yet they remain largely invisible in the policy discussions. When I was appointed to this role in September of 2024, I searched the New York Times to find out had there been any articles about COPD or asthma, considering that more than 650 million people are affected by this disease. There'll be a story. And I found one, and it was not a health report. It was an obituary of the Irish singer Sinead O'Connor that Those were the cause of death. And I was astonished to see that, because that same year, asthma and COPD killed nearly 4 million people in the world, and there wasn't an article by any of the major news organizations. So the reason, one of the main reasons why NCDs remain largely invisible is as they are a chronic disease and they're not infectious. No one can get asthma or COPD from sitting next to somebody who suffers from that. So that sense of urgency that that the infectious diseases bring is not there. So that is one major issue. The second one is we don't have chronic respiratory diseases doesn't have a very strong advocacy base in the world, to raise the voice, to engage with the media and the politicians to make it a policy issue. Many of patients are also too weak to raise their voices to do it. But that's beginning to change, and I think that we recognize those shortcomings, especially in getting the stories out to the public. And are working with the mainstream media, because up to now a lot of the discussions on asthma and COPD were really happening on very small settings in medical conferences, in clinical settings, and publications in medical journals. So we have to expand that circle. We have to go and capture the public's imagination. Because without the public's imagination, we will not be able to get the attention of the policymakers and get the attention that chronic respiratory diseases deserve.
Thank you very much. I think the question I have then for you is, why has it taken so long to get here, to get your role established? What has changed in the lung health environment that makes it more relevant now? And what are you doing to promote action at the national level from WHO?
Well, the world has just recovered from the COVID pandemic, and COVID, being a respiratory disease, although an infectious one, raised issues about the state of primary health care in many countries, the precarious state of primary health care, and especially about chronic respiratory diseases. We also have increased attention given to air pollution. And air pollution, of course, affects people with respiratory diseases disproportionately. So this gives traction to the conversation when we speak about chronic respiratory diseases. It's no longer seen as a disease that was caused by ex-smokers that people brought into themselves. Now, just by being born, by living in a city that's polluted, even before they're born, those children's lungs are going to be compromised and affected for life. So that is one factor. I think the second one is with the visibility on non-communicable diseases. There has been advocacy to bring about chronic respiratory diseases and give shine the light on the burden of the diseases. But it's still not sufficient. I mean, if you think about, there hasn't been a medical breakthrough for asthma or COPD in nearly 50 years. And that's because the lack of attention, the lack of resources for research, and the lack of urgency.
No, thank you very much for that introduction, Jose Luis. Moving on to our civil society representative and the patients. Susanna, how do you interpret this change in the lung health landscape? And why do you think there was no roadmap until now? No, you just speak.
Okay, I don't need to find the button. Okay, so now in the previous World Health Assembly, there was a resolution adopted on lung health, and it is calling for an integrated lung health care. So this is something which has completely changed in a way that we have some roadmap, we have some vision on how we should deal with the lung health in the world. And of course, since we are a European organization, IFA and our fellow associations in the European lung health group, we are immediately looking on how Europe should take this resolution. There's also a new report from the WHO on respiratory diseases in the world, and that is kind of setting the pace, what we know and what we do not know. But indeed, there were a lot of figures already mentioned, and you said, Fraser, that there are people behind the figures. And when we talk about 80 million people, all of them, they have families who become carers also in the case of severe respiratory disease, and so the impact is much wider. We believe in our respiratory community that until now, and we hope it will change, respiratory diseases have been much overshadowed by other chronic diseases, which are super important, like cardiovascular and cancer, while they may not be always equally prevalent in all parts of the world. And somehow respiratory diseases have been staying as some kind of a secondary concern. And to us, that tells that somehow lung health is taken for granted, even if we know that every single one of us, we need to breathe all the time, and we are breathing in all kinds of things. So we need to change this perception that you can always breathe freely. I think many people also who there have been the problem of wildfires and during summers, and that's when somebody who knows nothing about the respiratory condition, that's when they start realizing what it can be when you have a lung condition. Then there is the issue that lung diseases are much depending on prevention and preventative issues. And in Europe, even if prevention is, it has been stated many times that prevention is a priority. It's not really happening in a strategic way. So we experience that lung health is not integrated into the broader public health strategies, and this has real consequences not only for patients and healthcare systems, but also the population at large and future generations. Can I add a little bit more, Fraser,
well,
or do you want to move on?
What exactly specifically do patients' organisations want to see change in the landscape? What needs to be done to fill in the lung health policies?
Okay, so you move to the next question already.
Yeah.
Thank you so much.
At the time.
Yeah, so I will give one example. So we feel that if we have to choose one thing, early diagnosis is our absolute priority. And I just heard 2 days ago from my colleague from Lung Cancer Europe, who is working on a project called SOLAS, who is which is promoted by the European Union. This project, it's working on lung cancer screening. You know what they are finding? They are finding COPD patients mostly with the lung cancer screening. And that tells us something about what needs to be done. There is a very big need to focus on early diagnosis. I have a lot of examples across IFA member associations, the partner organizations, on what kind of gaps there are. People have often several years, even decades of gap in having a diagnosis, and that when that happens, depending on your lung disease, you get worse, and then you will get permanently worse. You will have lung damage, and then you cannot anymore properly prevent the progression of a disease. So it is urgent. So we are calling for recognizing this and giving it the appropriate prioritization as such. And we believe that there are savings to make in having early intervention. Then we are calling for integrated care, and this is what the World Health Assembly resolution was also about. And integrated care means that also that patients are fully integrated in their own care, and better access to screening. Our colleagues are doing lung health testing, spirometry testing outside this room. They were doing it the whole day and are going to continue tomorrow. This is something that is not existing in primary care everywhere as it should. Also, it's not incentivized necessarily, and that's why lung issues do not get the attention in primary care as they should. Then there are commercial determinants of health for lung health, and we need stronger regulations on industries that are harming lung health, such as tobacco, which Cornell is going to talk about soon, and other polluting sectors. And we should have accountability for marketing practices which are targeting vulnerable people, and in our case, especially young people. This should be prevented. We have inequalities, and we are here in Gastein, in the EU Policy Forum with this theme, solidarity. So we need to work on this. I could talk about this the rest of the evening.
But I'm going to stop you there.
Thank you very much.
To move on to Cornel Radulachin. He's the Secretary General of the European Network for Smoking and Tobacco Prevention. And we've heard a couple of times the impact of tobacco and smoking on respiratory health. And my question to you is, what do you want from policymakers in terms of tobacco control now? And how does it relate to a wider approach to lung health?
Thank you. And in fact, we don't need anything new. I'm here because we are dealing with a problem that should have been solved many, many years ago. And the only thing that was missing was the political will. Because here we are not discussing about the virus or other, let's say, condition. Behind the story, it's a very powerful industry. And here is the problem. We need the political will to stop this industry. And without this political will, we see we are still dealing with the problem. We had tobacco smoke, now we have vaping, because, of course, we tried and we did good things together with WHO and other, let's say, public health entities. We have the Framework Convention on Tobacco Control that entered in force 20 years ago. A lot of things were achieved, but again, that industry is not sleeping, and they are back on the market with new products. And of course, our lungs are affected. Maybe not like the traditional smoke from the cigarettes, but in a new way. And I can say that it's not a harm reduction. I can say that it's a multiplied harm, because a lot of people are not only smoking now the traditional cigarettes. They are smoking the traditional cigarette where they can smoke, and they vape where they cannot smoke. So their harm is multiplied, not reduced.
Thank you. So how do you see the future of European tobacco policy? Will Europe be united? And are there any initiatives in the pipeline that you expect?
Yeah, in fact, my organization, European Network for Smoking Prevention, was born almost 30 years ago when we had the Europe Against Cancer program. Now we have an Europe Beating Cancer plan. And in fact, we expect more actions like the revision of the Tobacco Products Directive. We succeeded to have at the EU level a new recommendation on smoke-free and aerosol-free areas, which is excellent. And now we expect a new joint action at the EU level. And as far as I heard, this new joint action SAFE, will involve 70 partners from almost all EU countries. So our hope is there, but the time, it's not with us. We have to speed up all the actions.
Thank you very much. And we have two other panel contributors, but I want to, they're going to be speaking more in the next session after our break in the middle. But I wanted to give them an opportunity to have their reflections on the contributions that the three previous speakers have made. Thomas, if you'd like to give your little reflections.
Yes, thank you so much, and I think I very much agree with what I've heard here, and I think the general and of course this is often the case in policy. We talk about evidence-based policymaking, but often the attention of politicians and policymakers is on one thing at a time, and the sort of bandwidth is limited. And I think that is a challenge, because I think it is very much about awareness, is about investment, and these things go hand in hand. But I think there's a clear case there that can be made. So I think working together, I think there's much that can be done, and I'll come back more to that maybe later.
That's great. And then Susanna, it's a bit confusing. We have two females on the panel. They're both called Susanna, but there's a Susanna and a Susanna.
Yes, exactly. I also absolutely agree with everything what I've heard. I just would like to add that one reason why respiratory diseases are not recognized compared to other non-communicable diseases is that respiratory diseases are often comorbidities for the patient. They have cardiovascular diseases and respiratory diseases as well at the same time. And maybe they have bigger awareness of the cardiovascular diseases or diabetes or whatever. And I think what is really important is to increase the awareness on respiratory diseases and to increase the health literacy on respiratory diseases as well, which is, I think, currently is very low. I'm from Hungary, and in Hungary we very often say that we do not even have a word for chronic obstructive pulmonary disease. We call it in Hungarian as COPD. So patients cannot relate to the disease because they do not have a Hungarian word for that. Okay. So and I think it's similar for other languages as well. So it's really important to increase the awareness of people on respiratory diseases and to find those communication pathways via which we can increase their health literacy.
Thank you very much. That's a very important point. You can't really know a lot about a subject unless you can name it, and that's a very important point. Is there anybody from the audience who would like to either make a comment or ask a question about this topic of the burden of lung health diseases and why there's not necessarily been progress so far? If not, there's two. Gregory here at the front. So, if you could just say your name and your affiliation so that people online know who's speaking.
Yeah, thanks. So, Gergely Mészáros from Hungary, European Reference Network. So we heard that there's actually a stigma we need to deal with regarding respiratory disease patients. My question is whether, and I do not know whether it should be addressed to Susanna, whether there's any way for patient organization to work together with other stakeholders to make sure that not all of the patients actually are stigmatized. There are unknown reasons why patients are living with rare diseases, other respiratory diseases. So I think that probably a change of mindset might be important at this point.
Well, whilst I let Susanna think of the answer to that, there was a hand at the back as well.
Hello, and thank you so much for this panel. My name is Sonja Block. I work for KPMG. Very important points, obviously, especially about the language. One was also made on political will on further restricting tobacco, and I think, since the existence of tobacco, this has been talked about. So, any best practices, good ideas to share to nudge decision makers to actually restrict further tobacco and vaping in the respective member states?
Thank you. So for Susanna, if you'd like to respond to Gagli.
My answer is obviously yes. We can work on this together, and we are already partners, all of us European level respiratory patient groups. So one thing that we are already doing is working together to raise awareness on lung disease, and bringing up patients to speak for themselves. One barrier, like Jose Luis said, for especially in COPD, is that even self-inflicted stigma, which can lead to not good things, especially if you are in severe COPD, because you can, as a consequence, isolate yourself even more than you are isolated by the status of your health, because you lose your strength. So we have together created European Respiratory Patient Advocacy Academy this year with our fellow patient groups. And one of the sessions for our trainee advocates is about addressing stigma as an advocate. So
great.
We take it from there.
And Cornel, do you want to talk to the issue of what we can do on tobacco?
In fact, I can give some examples of good practice. And many years ago, no one can imagine Irish pubs without smoke. Then Ireland took the leadership and they solved the problem. And then this problem was solved everywhere, almost everywhere, at least in the European Union. Now we have another champion. We have the Belgian government, the Belgian Minister of Health, and new regulations will be in place in Belgium from 1st of January next year, like smoke-free outside spaces, and also they will ban vaping on the outside, in some outside spaces. So we have champions, but we have only champions. We need a unity of all governments to do this for the health of their citizens, not only isolated cases. Yeah.
Thank you, Cornel. Well, we now move on to a Slido. So if I could ask the technicians to put up the Slido question. So if you will get your phones ready to grab hold of the QR code. There's the QR code. Echo. There's the QR code on the screen, and the question is, how long does it take for asthma to be diagnosed in the EU? So what I'd ask you to do is to provide your thoughts of how long that might be, whether it's weeks, months, days, years, decades, whatever unit of time you think it will take. And if you put in your answers there, and we can see the answers coming in now. 4 to 5 years, 10 years, 2 years. 2 years seems to be winning at the moment. The problem is, of course, this is a very educated audience. So my guess is that there's self-selection going on here, and that the Slido is giving an answer that a lot of people might know anyway. Should we put the answer up and find out what the actual answer is? Right, so here we are, 4.5 years. Now that might be quite a surprise to a lot of you. And this is the research that we've undertaken, that accurate diagnosis takes this long to get in the EU. So you can imagine in some other locations outside of the EU how problematic patients getting an accurate diagnosis that allows their treatment to be effective is. And so that's why we're calling for people to have spirometry testing as part of their primary health care, so that people can find out very early on any underlying respiratory conditions that then need to undertake this sort of pathway to finally get their treatment. Okay, so now I'm going to be moving more on to what it is that we're actually doing or trying to do. Now we've scoped out the problem itself. I want to turn to Thomas Alvin. You're the Executive Director for Strategy and Board Coordination for Health Systems, Policy and Partnerships at the European Federation of Pharmaceutical Industries and Associations, that's FPA. At the outbreak of the COVID-19 pandemic, the pharmaceutical industry jumped at the opportunity to support respiratory infections, or the combating respiratory infections, I should say. There was a lot of cooperation from the sector. This seems to have passed now. There is room for these efforts. Does that include EU joint procurement and prevention? And if so, how would you be able to support this?
Yeah, thank you. Thank you for the question, and thanks again for the invitation to this panel. So I think, you know, the COVID pandemic, obviously, as you said, it was sort of a once-in-a-century event. Well, let's hope it's once in a century. We don't know, right? And I think what we saw was, I mean, it was a unique event in terms of all the focus was on that. All the policymakers focused. They needed to solve this. So all the forces in society, public, private, academia, everyone was on the case at the same time. And a lot of money was put on the table to fix it. And, you know, the Commission, the member states had these advanced purchasing agreements where they committed to procure any COVID vaccine that made it through the authorization and was effective. We will buy it for this amount of money. Of course, that creates a huge injection, a huge stimulus. And of course, we collaborated with the Commission and member states in many other ways, just solving problems. There were medicine shortages, problems with clinical trials, etc. So it was just a huge effort from everyone. And I think the answer to your question is like, well, now we're back to kind of normal. I think we in the health sector think that, well, you shouldn't forget about COVID and the lessons learned, but of course, policymakers turn their attention to other urgent issues. So I think we're on those topics kind of back at where we were before. In some cases, maybe even worse off, and you can see the attention at the EU level, at least on health policies, is sort of slipping away a bit. But I think on the issues you mentioned, and of course, you know, joint procurement is often heard in different contexts when we talk about access to medicines. I think, again, you know, the COVID pandemic was very particular in that sense. We had a few vaccines that were purchased in advance. Everyone wanted the same stuff at the same time in all member states, and the money was on the table. So it was a very, very particular situation, and that's not usually how it looks like for any disease or any particular treatment. And I think the evidence shows that when so far, I should say, you know, when member states come together and try to do joint procurement, even if it's very similar countries like the Benelux countries, it's usually hugely complicated. They can't agree on what are they going to buy, you know, at which price for which patients, what data, you know. All of this takes a very long time to coordinate. So it's often just faster. You get faster patient access by going to each country. That's the experience of most of the FBI members. So I think that's why we often think that this is not a panacea. But I think prevention, absolutely, and I think we heard that already. Prevention is key, both primary and, you know, you have all the environmental, you know, primordial prevention, but also, you know, the secondary prevention, hugely important, the early diagnosis and detection. So there we're fully on board.
Great. I think we heard a lot about the battle for other NCDs, about cancer, the Beating Cancer Plan, and now the plans for a cardiovascular action plan. And FPA members have been very forthright and forceful in their support of those initiatives. But now there's not really been the same push so far from FPA members on respiratory health. So my question is, why is that the case, and do you envisage that those voices to be raised?
Yeah, that's a good question, and of course, to some extent, is that the industry is diverse, a lot of different companies, and they're into different disease areas. So, of course, to some extent, how many companies are in this area currently, and maybe we'll get into that a bit on how it looks like. But I can, it's a very iterative process where FP as an association doesn't sort of select a disease area to champion because we're representing all our members, but it's rather a community is being formed across stakeholders that we need to do something together. And then of course also FPA companies and then also FPA usually gets involved at some point and say, okay, let's do this. So it's not necessarily that the initiative will come from us, but there is a political momentum building somewhere, and patient organizations, clinical societies, policymakers, also industry, starts to coalesce. And so I think it's that kind of movement that we've seen on cancer, we see it now on cardiovascular.
Fine. So now I think it's great that we've heard from the WHO, we've heard from patients, we've heard from campaigners on tobacco, we've heard from the industry. But what about the member states and the research community? What can they contribute? So Susanna Mikolos, you work with the Hungarian Institute, and you're working within JARED, the Joint Action on Respiratory Diseases. The question I have is, let's see, climate change and the aging population that Europe have are increasing respiratory problems. And we're confronting a scenario where there are lots of inequalities in lung health. So what is the impact of these impacts on patients' access to medicines and health?
Thank you very much for inviting me, and it's a great honor for me to represent the Joint Action on Respiratory Diseases, or as we abbreviate it, the JARED here. Actually, first of all, I would like to introduce this project a little bit. This is an ongoing EU4Health joint action program which started last December and will last for 3 years. And it brings together 38 organizations from 16 European countries, and it is coordinated by the National Korán Institute for Pulmonology in Hungary. The professional leader of this project is Professor Ildikó Horváth, who among her other roles is the current Secretary General of the European Respiratory Society. And I myself, I am a medical doctor with rather a scientific and academic background, but I'm supporting Professor Horváth in the implementation and coordination of the professional work in this project. I need to say that this project is pioneering in a way because this is the very first EU4Health joint action project in Europe that exclusively focuses on chronic respiratory diseases. And our consortium in JARED was built by very enthusiastic partner organizations and professionals who warmly welcomed the call for action 2 years ago, and seeing it as a strong signal of the EU Commission's intention to support joint work on key areas related to chronic respiratory diseases. Our mission is to reduce the burden of respiratory diseases, and because, as we have already discussed, they are still the leading, among the leading causes of morbidity and mortality in Europe, and yet they are under prioritizing health policy compared to other non-communicable diseases. Our project focuses on several key areas which include just a few examples: strengthening of prevention strategies with a big focus on tobacco control, and supporting early diagnosis, supporting vaccination programs, empowering patients in self-management, also by introducing digital tools in self-management, and also analyzing and trying to find solutions to improve the care in chronic respiratory diseases. And it is also important to mention that in addition, and very importantly, we are also committed to addressing the inequalities in health related to respiratory diseases, to improve health literacy, and also to address vulnerable groups. But we think that this project is really unique and important because it builds on member states working together, pooling expertise, and trying to identify good practices which can be scaled across the European Union. And we truly believe that this project will deliver not only trainings or recommendations for policies and practical toolkits, but in addition to that, it will pave the way for a comprehensive European lung health policy. We are enthusiastic enough to truly believe that, and we are ready to take on this responsibility.
It's wonderful to hear. I will be bringing that back to you later on, I think. But the question still remains about the fact that the JARED is looking at the situation now, but climate change and an aging population will increase the demand for respiratory care. So what is the impact of these developments going to be on patients' access to medicines, and is that included in your work?
Yeah, actually, yes, it is included. Actually, what we are trying to do is to do landscape analysis and to find the good practices in the European Union, because there are many good initiatives at national level, but we need to find them, and we need to find a way how they can be generally used in the EU, and to give modular toolkits from which the countries can choose what they fit best for their health system, what they can use. And what you mentioned, Fraser, climate change is really important, because it has been mentioned that the burden of chronic respiratory diseases is continuously growing, and there are several factors which contribute to that, among which we need to mention the climate change as well. And at this point, I would like to emphasize that it is very important to know that certain consequences of climate change, including, for example, extreme cold weather conditions or heat waves, or consequences which impair the air quality, such as wildfires, or longer periods of drought will directly have an effect on the respiratory health of people. They will increase the prevalence. They will increase the exacerbation rate, the mortality rates of chronic respiratory diseases. So it is very important to know that if we take measures to normalize the environmental changes or to somehow fight them, we will do something directly for patients with respiratory diseases.
And like the first part, I now want to turn to the other panelists for their reflections. So first, Jose Luis, the way in which the landscape has been painted here from your other stakeholders, what do you expect to be able to do with those other stakeholders in your role, and what do you expect WHO to provide as facilitation in the way in which we now respond?
I think, let me go back to prevention. I think this is, you heard us all speak about prevention, but that continues to be the frontline tool that we have, the most cost-effective one, and also the most equitable one. I think when we address prevention, and that is by enforcing tobacco control policies, clean air guidelines, we are addressing, or we are preventing millions of cases of chronic respiratory diseases. And we're also helping those who are, those hundreds of millions of people who are affected by these diseases to breathe better. I think the issue of access to medicine is another that is important, and we have to put that on the table. When COVID came in the scene, there was a center of gravity, and the world responded quickly to address that. I wish that the world would respond the same way to chronic respiratory diseases. It's definitely killing more people than COVID did, so we need to treat it with the same urgency. And the other part that is very important is regarding the new products that are coming into the scene, like vaping, for example, and this was mentioned by Cornel before. We have to be prepared, and we have to be able to respond swiftly to address the harm that these products are doing on our youth, because if we don't, it's going to be too late, and it's going to be very hard to help those people who will be harmed by them. Mm.
Thank you very much, Jose. Turn to Susanna, and I'm sure your ears pricked up like mine did at the suggestion that we need, from member states, a concerted action plan. But have you got any other thoughts, and what are your thoughts on that?
Yes. Before I come to that, I loved what Susanna was sharing with us on the ambition and values of the Jared. This is really great news. When you know that there is this database by the European Commission on best practices in non-communicable diseases. And in fact, when there was previously a call to new best practices in that IFA and others, we will try to find with cats and dogs best practices on respiratory diseases, in our case asthma and COPD. We found one or two, okay? And one of them was submitted to the portal, and it's there. So if you find these best practices, this will be great news. But at the same time, we do believe that we need to create these best practices, and that's why we need a comprehensive European level EU plan on lung health, and we have the manuscript now from WHO in a way where to go. So yes, thank you for the question.
Great. Cornel, we had lots of references throughout both of the sessions on the importance and significance of tobacco. What's your reflections on those contributions now?
In fact, I'm happy, and it's normal to have a lot of reflections on tobacco, because almost everyone knows everything about tobacco, but only few people are doing things against tobacco. And what I hope is that more health professionals will be involved, not only, let's say, lung physicians or oncologists, but other specialties, because we are missing them. They have direct contact with the patients, and they can give the brief advice. It's very easy. It's very cost effective. And let's hope also that our politicians will be more, let's say, attracted by this subject, because it's really a popular subject on the long term, not on short term, but on long term, it's really a good subject also for the politicians.
Yeah, I mean, for me, the important missing component of the Beating Cancer Plan is the complete modernisation of the tobacco regulation as a preventive measure. That hasn't yet happened. Bits of it have.
Let's hope that now in November we have the 11th Conference of Parties, WHO FCTC Convention. And yeah, let's see what will happen there at the COP11.
Okay, fine. So with that, I want to move on to the audience here. If there are any questions to any of the panelists, but especially sorry? Yes, I know. I'm going to invite them online afterwards. Is there anybody with a... So I have two intervenants here. And once again, if I could remind you to introduce yourself so people online know who you are.
Thank you. Hello, I'm Danai. I'm an accredited parliamentary assistant. And I would like to thank you all for the panel and maybe make a comment and then embody a question into it. I like the comment that we don't even know the language that you said, Susanna. So like in Hungary, for example, COPD would not mean a lot. But I think this is the case with many other diseases, like NCDs also for people outside the area of discussion, or for a simple citizen, maybe they also don't know. So it's really more the communication, political will behind maybe to raise awareness on a certain topic, even if there is no direct translation in one's country. And what would make it also maybe more interesting is always to try to connect it with the benefits you can have in the society in the long term. So you mentioned some cost-effective benefits, but how can we really make these be more concrete with statistics? Because I think this was the motivation behind Beating Cancer Plans and now NCDs. There are a lot of prevailing statistics showing how many people are affected from that, and how this can change if we invest in prevention. So it could be the same thing for the COPD diseases, and of course in relevance not only with tobacco but with climate change. And thank you for highlighting this factor, because in the long term, with more climate crisis, this can be more and more urgent and more important also for the political agenda.
Thank you very much. And I'd just like to reflect on the fact that NCDs, COPD, it's not a problem in other languages. It's also a problem for English speakers, for native speakers, trying to communicate to ordinary people in the UK what COPD, NCDs actually means is also a barrier. So, could I just ask the...
Thank you. I would like to thank you, first of all, for this interesting panel. Even despite the late time, we are really grateful that you are here today and you shared very important information. So my name is Olga Limenko. I'm from Ukraine and I work at WHO country office with prevention of non-communicable disease. So as we see for today, about 20% of Ukrainian teenagers are active users of e-cigarettes. This number is even higher than active users of conventional cigarettes. And we clearly see that tobacco industry is introducing novel nicotine products, and actually heated tobacco products were introduced almost 10 years ago. But at the same time, Tobacco Control Society uses the same strategy that were introduced 20 years ago with FCTC. So here is my question. Do you think that we as a Tobacco Control Society need to introduce novel tobacco and nicotine control measures? Not only about nicotine-free spaces, not only about the prohibition of advertisement and so on. So maybe there are any other strategies that could work. And I will step in here. There is a framework of WHO as a project, Nicotine and Tobacco-Free Schools. And we are implementing this in Ukraine for the 5th year in a row. And we involve teachers to become tobacco and nicotine control advocates as well. So in terms of novel strategies of nicotine control, what else can we do as Tobacco and Nicotine Control Society to protect our children? Thank you.
Thank you very much. A very, very good question. Jose?
I could respond to some of that. I think And just yesterday, I saw at the ERS a study that was done in Germany about vaping and the impact of raising taxes, and how immediately when taxes were raised, the number of users in vaping dropped. So raising taxes is one of the tools as part of the Empower strategy that we have, that we know is effective, that we make it more expensive, especially for teenagers. They won't be able to afford the vaping. So that's one tool. And I think that governments, is one of the things that WHO is calling, about raising taxes on tobacco and those products that harm health, as a target. Our Director General has called for an increase of 50% on taxes for those. But I'll let Cornel, who is an expert in this, speak.
Thank you, Jose Luis. So, in fact, we can learn from the tobacco industry, because what they did, they come with the new products just to avoid the regulations to the traditional tobacco. So now we have to learn how to use the social media platforms to communicate our message to the young people. But what is more important from my side is to teach our politicians, and again, I'm going back to the politicians, to create and to invent new pieces of regulations that are predictive, not reactive. So we don't have to react on what we have to predict what will come. And I can give you an example in the area of advertising. Now we know more or less how the tobacco industry is advertising the products, but maybe tomorrow we'll see drones advertising tobacco, and for sure the drones will not be in the law. And they have all the rights to do this because they have to keep their business, to keep their customers, and that's it. So predictive legislation, and also to use new ways to reach the young people, because this is the target for the tobacco industry. They need new customers. It's obvious.
I want to go to the questions online. So I ask Anna if she could read out some of the questions that have come in from the online audience.
Firstly, thank you so much to the online audience who has been very active throughout this discussion. We've got questions from across lots of different themes, so from climate change to health literacy to prevention, and also the lung health resolution. I'll start with a question related to prevention. So how can we prove with specific data that prevention can be here more beneficial, not only for the individual, but also for the society? And something more related to the EU policy, but lung health overlaps with many European initiatives, such as the cancer plan and cardiovascular plans. How can we ensure that respiratory isn't missed across these overarching programs? And the most popular question, but I don't know if we'll get time for this, is to what extent should we worry about the increased prevalence of lung disease in related to climate change?
Okay. So who wants to respond to the prevention agenda?
I can begin with that. I think that there is overwhelming evidence that shows that prevention works. For example, just recently, to give an example, the University of Chicago's Institute of Energy published a report that the countries that that implement the WHO clean air guidelines, the people live, over 1.9 years longer. So that's a fact. That where there is clean air, there will be fewer people getting sick. People will live longer. There will be fewer hospitalizations. I mean, we have data across countries that demonstrate that. Then where people are smoking less, there are fewer people getting sick. So we have well documented data through surveys that are done and published to back up the prevention. The challenge with prevention is that if it makes you, if you don't get sick, you don't get noticed as a case, and therefore the policymakers don't act on that, or it takes time sometimes for prevention to work. And as you know, election cycles are not are short, and the terms of many elected officials are also short, so they're interested in what works right away. But in terms of evidence, there is overwhelming evidence that prevention works across in clean air, in tobacco prevention, healthy food, etc.
Susanna, do you have anything to contribute about how that applies to the European Union context specifically?
Yes, maybe, but I wanted to expand on that because IFA and our member associations, we are a patient network, so we have loads of stories how climate change related or air pollution related events are actually harming lung patients today in ways that they are they are advised to stay at home, close the windows, and not to go anywhere. So it's affecting right now. So in that sense, Jose Luis, if there is preventative measures, they are felt immediately by patients who already have a lung condition. So I think we should communicate that better. And I love the idea that you were saying about that. What are the benefits? Because if we start thinking about the future, if we continue like this, is there a future in not a near future, but a distant future where every single person has some kind of lung issue? I forgot the questions from the online audience. Fraser.
Okay, so whilst I'm sure Anna has others, but I wanted to also get the other Susanna, viewpoint of what the member states in the EU can contribute from a prevention agenda.
They can contribute to several things, and what I also would like to react is the question here concerning the strengthening of primary care and what we can do. It is very important to know that it is a very hot topic also within Jared, and I think in everywhere, that how do we distribute, divide the tasks and responsibilities of primary care and specialist care in case of chronic respiratory diseases. And there was a question related to asthma care, but I think it's not just asthma, it's all chronic respiratory diseases. It is really important to involve primary care in the early diagnosis of chronic respiratory diseases. And what is really important that as we are doing the landscape analysis within Jared, what we can see is that the division of work in different countries is really different. There are systems where there are well-educated primary care professionals, well-equipped professionals who has the right and opportunity to participate actively in diagnosing CRDs and initiating treatment. However, in other countries, the patients should need absolutely rely on specialist care appointments. However, the accessibility of this secondary care level is limited in many areas in Europe, and I think as a consortium with different member states, what we can do, and not only this respect but also with other issues, is to compare our practices and to see that which are those which work and which are those elements which can be used in other settings as well, in other healthcare systems, and we together can give I have already mentioned what that's what we are thinking about, is to develop modular kits in which we say that there are several practices which work in countries which are different with different healthcare systems, but this can put together a general recommendation on how to go on with different aspects of prevention or treating respiratory diseases, and this may be a basis for creating policies, and then the different member states can tailor these policies to their own needs and their own healthcare systems. So that's how we imagine we can contribute to this. And also by engaging everyone, so all stakeholders
well, talking about
who are important.
Engaging everybody, we've heard a lot about different preventive strategies, but we haven't, they're both mostly talking about either early detection or talking about threats such as air pollution or tobacco. Nobody's talked about vaccines and the role that they might play. So I'll pass the floor over to Thomas to perhaps outline what the pharmaceutical sector can contribute in the prevention agenda.
Yeah, thanks so much for that question, and I think that when it comes to vaccines, play a very important role, and there I think that we have a very healthy vaccines pipeline with a lot of approved vaccines out there against respiratory infections, RSV, etc., flu. I think because we know that if we look at COPD, for instance, a lot of exacerbations for patients or have an infectious component. So by using vaccines more, we can help people in risk groups, and so there I think it's mostly a problem of, frankly, low uptake and member states not investing enough in vaccination programs for different reasons. And I think that's again a very cheap way to achieve a very big effect. But I think then of course also we have therapies, innovative therapies, and maybe not as much R&D as there should be in the pipeline. There could be new biological treatments for several of these diseases. And there I think again that there are a lot of factors contributing to where you do R&D investments as a pharma company. I think this is an area where there are still basic science challenges on how some of these diseases actually work, the mechanisms behind, for instance, COPD, different types of COPD, what is the mechanism behind an exacerbation. They're usually very costly to do clinical trials in this area because you have to do it for a very long time, because these diseases progress over very long time. So it keeps very long, needs to have long monitoring. That means it's costly, and also you have a lot of confounding effects with these other comorbidities, which makes it difficult identifying the right patients. But then I think it's a lot of the wrong incentives when it comes to sort of the payers, the health system, so HTA and pricing reimbursement of new medicines. When it's about what do you measure, what are the endpoints? In many of these cases, it's not mortality. So you can't use the same endpoints as in sort of several cancers, but it might be more patient-reported endpoints, right? Quality of life, ability to participate in daily activities. Those are more difficult to measure. It's patient-reported outcomes. Many regulators and HTA and payers don't really like them. They think they're too fussy. And then if that's how you are going to demonstrate the higher effectiveness of a new biological treatment, then that's going to be challenging. And all of these are challenges that makes it a more risky investment to invest in this area. So I think, again, here everyone needs to come together and say, okay, we want to invest in this area. How do we do this together with policymakers, HTA agencies, payers, to get the right signals? And again, I think the underdiagnosis, to come back to that, is another problem, because that also drives that there is a lack of incentive if you have underdiagnosis, because you don't even know how many patients there are.
I think it's really important as well that you highlight the impact it has on the people is the most important thing. The long-term sufferers, the people behind the numbers that we spoke about earlier. Susanna, if you could
Yes, if I can come back to the to the question about the cardiovascular plan and the cancer plan, there are many opportunities there to cross-affect also respiratory diseases because of the preventative measures that they can address. But at the same time, when we have heard today about the challenges in underdiagnosis and the high prevalence and the fact that in respiratory diseases, we, the patients, we are rare, we are prevalent, we are infectious, we are genetic. So there is great diversity as well. So we believe in the European Lung Health Group and in our communities that after cardiovascular and cancer plan comes the lung health plan. And that is, of course, like Thomas said, it's a community effort. We need everybody. We need those who are the traditional community, but then we need others as well. And Jared is a good opportunity, I think.
Well, thank you. I agree totally that it's a good starting point, but that we want to see in the end a much more concerted European Union strategy, action plan that would confront respiratory health in a way that facilitates member states actually abiding by the WHO resolution and implementing the WHO resolution by having such a European Union action plan, bringing all the stakeholders together in all the dimensions. I want to thank all of our panelists today. It's been an excellent session, despite the fact that it's been very late. I know that we've only scratched the surface of the topic. It's an inevitable outcome when we've got such a brief period really to discuss such a wide-ranging problem. But I think we've really outlined the scale of the problem. We really fleshed out how important responding to respiratory health is, as well as some of the commitments we've already made, the new developments that have meant that we have Jose Luis in his role as a WHO representative on lung health, and that we have a WHO, we have a resolution on lung health, which is a commitment all the member states have made to actually improving the situation. And then we've heard how important it is to patients, how necessary it is for not just the people who suffer, but the people who care for those people, the people who live with patients, as well as the patients themselves, as well as then hearing how we really need to continue the fight. One of the things that's problematic about tobacco control is that they're very, very effective, the tobacco industry, at slowing down regulatory progress. And so it's much harder to be proactive when they get the ear of senior decision makers long enough for them just to hesitate and slow down. And then we have heard that the pharmaceutical sector as a whole and the European part of that industry is still committed to the issue and will make its contributions as necessary. But most importantly, I think we've heard from the member states that they are actually committed and that they are serious in their efforts and that they have started a journey. And we hope that journey continues strongly in the next few years and eventually leads us to a path where we have a concerted European Union action plan on respiratory health. I'd like to thank everybody for coming here. I'd also like to thank our online audience. It's difficult doing this role when you don't see the people distant who are interacting and you can't actually see a lot of their engagement. But I'd like to thank them all for joining us here at this session. And with that, I close our session today. If you'd all like to join me in giving a round of applause to our panelists.